Hello everyone and welcome to Bullet Points in Forensic Medicine series video number 4. इस वीडियो में as you can see the heading on the screen, what we are talking is preservation in forensic medicine, right? So just like every time, let's begin the video by taking up two prototype questions that may arise from this topic in forensic medicine. So the first one is, fresh blood is soaked on a cloth from the dead body of a victim of crime during autopsy, right? How will it be preserved? So very straightforward question, that if we have fresh blood and we need to preserve it, although the question itself tells that the blood has been soaked on a cloth, now what needs to be done? Okay, so these kind of questions come in forensic medicine. Another question, let's see. Question number 2. An autopsy is conducted on a victim who allegedly consumed sulfuric acid. His viscera will be preserved in. So the question number 2 again is a very straightforward question talking about visceral preservation in autopsy, but in this case the particular compound or the chemical is sulfuric acid consumption, right? So now we understand that we are going to talk about some very important but very common preservations that are done around autopsies or during investigations in forensic medicine. So let's quickly have the note of all the important preservations, right? So this table gives us materials to be preserved and what are the preservatives which are either added to the material or what are important preserving techniques that we need to use. So let's see the first one. The first one is viscera for toxicological analysis. Very commonly asked. So very commonly asked because it is something that is routinely done in forensic dissection room, and the answer to this is saturated solution of common salt. Saturated solution of common salt is the preservative that we use to preserve viscera after autopsy. Second is, what if the viscera has to be preserved in a dead body who has consumed sulfuric acid? So viscera needs to be preserved, but here the compound allegedly is sulfuric acid. In this case there is a variation. Now we do not preserve the viscera in saturated solution of common salt, rather we preserved it in rectified spirit. We preserve it in rectified spirit. Okay. How about tissues for histopathology? If we are preserving tissues for histopathology, the preservative is 10% formalin. The preservative is 10% formalin. How about skin and subcutaneous samples? Now, why would somebody preserve skin and subcutaneous samples from a dead body? These are preserved in cases of injection pricks or any bite marks on the skin. So remember, so if you have a situation where there are injection prick marks on the body or any bite marks, and you want to locally analyze that skin area where the prick or the bite has happened, that what kind of poison might have entered the body, you want to preserve that tissue, you need to take a cut section of that tissue just like a biopsy, and then we preserve it in normal saline, right? What if we are preserving lungs, and lungs का preservation कब किया जाता है? Lungs are to be preserved in cases of inhalational poisoning. So any kind of inhalational poisoning has happened, the person has died, and we are preserving lungs. So first of all, remember, lungs are preserved in toto. So we do not cut segments of lungs or lobes of lung. We preserve whole lung, both right lung and left lung, and we preserve the lung in saturated solution of common salt only, but then the jar has to be topped with liquid paraffin which over a, once you pour the liquid paraffin on the top of the mixture, after a while it will dry up and an insulation will be created, right, between the lid and the remaining portion of the jar, so that nothing escape out from the lungs into the environment, as the jar of the lungs will be preserved, or whatever time that might be taken for that jar of the lung to go to forensic science lab. So there is no loss of the inhalational poison. How about wet semen? So if you find wet semen, right, what do? You preserve swab and smear, and both of them are air dried, normal air dried. Again, very commonly asked in examination, or very commonly asked area around preservations in the examination. If not exactly the same thing has been asked in the examination, but very very important to remember, we do not do any special technique to dry the swab and the smear. We just air dry them, right, in normal temperature. Also remember, normal temperature. So for drying of the specimen, we do not either use any colder or hot temperature, normal temperature. What if dried semen on clothes are found? They may be sealed as it is after cutting the portion of the cloth, or the cloth to be sealed in toto. Okay. How about wet blood? Just like whatever has been asked in question number 1, remember. So wet blood, you soak it on a cloth, right, then you dry it in normal air and normal temperature, and then seal it. This exact question has been asked in exam also. Remember, it's a very very important evidence to be sealed in cases of homicidal crimes. Blood becomes a very important trace element. How do we preserve blood? How do we seal blood? We preserve blood by taking the drops or the wet blood on a gauze piece or a cloth. We dry the cloth in normal air, normal temperature. Once it is dried, we simply fold it, we put it in an envelope, we seal the envelope. That's how we preserve it, right? How about dried blood? If you have found dried blood on cloth or any paper material, then it is already dried. You simply seal it as it is. Okay. Now coming to the last 3 but very very important sealing materials that may be seen in cases of examination of sexual assault victim. So consider you are examining a sexual assault victim, and you need to preserve pubic hair on her body. If pubic hair are present, then there could be 3 kinds of pubic hair that may be encountered on a body. The first one is intact pubic hair. Now intact pubic hair definitely belongs to victim, right? Intact pubic hair definitely belongs to victim herself, because those are intact on her body. These are to be preserved by plucking, right? The idea is to preserve the hair bulb along with the hair shaft also. Okay. Loose pubic hair, they may belong to victim, they may be of the assailant who might have sexually assaulted her, right? So they need to be collected by combing. So anything loose can be combed out, right? And matted pubic hair, the matting of pubic hair could be due to any kind of seminal ejaculation. So what we need to do, we need to cut them. So there are 3 techniques: plucking, combing and cutting, that we need to remember for preservation of intact pubic hair, loose pubic hair and matted pubic hair respectively. And all these 3 kinds of hair, if found on a body, they need to be preserved separately in different envelopes and labeled accordingly, right? So these were some important preservations that we encounter or that we do in forensic medicine and daily practices. And sometimes हमारे examinations में questions preservation पे आते हैं. Now we know that इस segment में से अगर कोई question आएगा तो हम गलत नहीं करेंगे, right? I'll see you in next video. Till then, bye bye.